So here we are discussing about the vitamin toxicity. So what we were discussing in previous classes, mainly micronutrients, vitamins, minerals, and also the functions of different types of minerals. Now today we will be discussing a brief account on what is vitamin toxicity, which is something you have not studied earlier. So in case of vitamin toxicity, it is also known by the name hypervitaminosis. Hyper means more. Vitamin means vitaminosis means excess of vitamin. Too much of vitamin. And it's a condition caused by consuming vitamins in amount that exceed body's capacity to use or store them. So body has a natural level up to which it can process safely. So if we are consuming too much of anything is always poisonous. So like that, in case of vitamin also, too much of vitamin can create problems for the body because body cannot handle it properly. So fat soluble vitamins like A, D and E and K, these are known as because they are dissolved in fat solvent and they are creating more problem because they accumulate in body tissue. So that is compared with the water soluble vitamins like B or C, the fat soluble vitamins, the 4 fat soluble vitamins are creating more problems, while most water soluble vitamins are less likely to reach toxic level except in very high supplemental doses. So unless we are taking too much amount of water soluble vitamins, it is not creating much problem. But in the case of vitamin A or vitamin D or vitamin E and K, they have to be taken more cautiously, otherwise they may accumulate in our body tissues and that will be creating problem for us. So vitamin toxicity occurs when intake of vitamin leads to harmful levels in the body and that will be resulting in physiological disturbances. So what are the situations that will be leading to this overuse or over intake? One is overuse of dietary supplements. Nowadays many people are taking dietary because people do not take a balanced diet. So they know that their body is suffering from lack of many vitamins and minerals. So in order to compensate for that, they will be purchasing these supplements from medical shop or from supermarket, and they will be taking it regularly. And this habit, without the proper consultation of a doctor or without proper medical diagnosis, can result in a situation known by the name hypervitaminosis. So overuse of dietary supplements, excessive consumption of fortified foods. Many of the fortified foods like milk etc. may be containing too much amount of vitamin. Then certain medications or interactions. Sometimes what happens is that the medications people usually take like blood pressure, cholesterol, diabetes etc. These are taken almost every day. Such kinds of drugs can interact with the absorption or metabolism of the vitamins, and that can create problem. Rarely extremely unbalanced diet. Extremely unbalanced diet means if a person is taking only carbohydrate. For example, he or she is eating a lot of rice and not much amount of curry, only kanji. Every day lot of kanji with uppu. That's it. That is for breakfast, lunch and dinner. So only carbohydrate the person will be getting. So he or she will say that it is great. But actually body is suffering. So if you take only kanji contains only carbohydrate and salt. Salt means only sodium chloride. Then sometimes what they may be taking some papada. So this kind of minimalistic food can create problems for them. Very well health notes that vitamin toxicity is relatively common, with tens of thousands of cases reported annually in children in the US alone. So why fat soluble vitamins are riskier? So that is earlier we were discussing about that. There are two different type of vitamins, and out of that A, D, E, A are more severe, more toxic because they are stored in the liver and fatty tissue. So these are fat soluble vitamins, so they can naturally get deposited or stored in fat tissues and also in liver. because body cannot easily excrete them. They may accumulate to dangerous level over time. That is also another problem. One, they can dissolve in, they can get stored in fat tissues. That is one problem, and also in liver. And our body doesn't have the capacity to excrete them properly. So that also is a creating problem. So in the use of water soluble vitamin, they can be dissolved in urine also, etc. If there is excess of water soluble vitamin through kidney, it can be eliminated. But there is no such a mechanism for removing fat soluble vitamin. So in case of these are some example: vitamin A toxicity, hypervitaminosis. They can cause headache, liver damage, irritability, bone abnormality. See, even though it is a vitamin, which we always say that, but too much of that vitamin can also lead to bone abnormalities, because it may be interfering with the metabolism of the calcium or other thing, so, and also causing liver damage. So here you can see that vitamin A, even though it is highly useful for our development of retina, rhodopsin, etc. But absent too much of that can create problem. Then another is the vitamin D toxicity. It is leading to high calcium level. That is one problem, because vitamin D and the calcium absorption are directly related. Too much of vitamin D means too much of calcium absorption, and kidney damage will be there, and similarly vomiting, nausea and weakness can also happen. So that is the problem with the vitamin D toxicity. Then next one is the vitamin E, a very rare vitamin, but increased bleeding risk. So that is the problem. If there is some kind of injury to the body, that can result in too much of blood loss. That is the problem of vitamin E. Then K toxicity, extremely rare and usually linked to intake of synthetic vitamin K. Artificial vitamin K products are taken, that can also lead to vitamin K toxicity. So these are some examples of different toxicity created by vitamins. Now coming to water soluble vitamin, compared with the fat soluble vitamin, the risk produced by water soluble vitamins are always lower. So, but not completely harmless. Water soluble vitamin, there are two types of vitamin. One is C, other is B. B1, B2, B3, up to B12 vitamins are there. They are generally excreted in the urine, but high doses can be harmful. So this is one, because this is soluble in water, and urine is also water. So if there is too much of water soluble vitamin like B or C, they can be processed by kidney and also get dissolved in water, urine, and can be eliminated safely. So one is vitamin B3, niacin. Excess can cause liver toxicity and skin flushing, redness of the skin. So that is one problem of vitamin B3 toxicity. Then B6, it is known as a pyridoxine, and high doses may cause nerve damage and sensory neuropathy. Neuropathy means nerve damage. Damage to nerves is known as a neuropathy. Then similarly vitamin C, that can also cause gastrointestinal problems and kidney stones. So here also you can see vitamin C is also, too much of vitamin C is also harmful. So this is an idea regarding how different vitamins can interfere with our body and also creating problems for us. Then what are the general symptoms? Some of the symptoms we have already seen. Nausea and vomiting is common. Fatigue and irritability, headache will be the common. Then liver dysfunction, malfunctioning of the liver is one important. Then neurology, here you have seen the neuropathy, like vitamin B6, it can result in nerve damage. So diabetic neuropathy, liver, then abnormal calcium level can interfere with the bone metabolism, the rigidity of the bone. Then skin changes means here you can see that the skin flushing, redness of the skin. So these are some of the major symptoms associated with the vitamin toxicity. Now how we can diagnose and go for a treatment? One is medical history, especially the person, if the doctor when asks, they can understand whether person is taking too much of vitamin. Then blood test to measure vitamin level. That is one way to safely, to accurately measure how much of vitamins are present in your body. Then assessment of organ function, like liver function test, kidney function test, such kind of test, lung function test, such kind of tests are available. Then mainly the treatment will be focusing on stopping the offending vitamin. If a person is taking too much of vitamin A, that he must be told to stop the intake of vitamin A or such kind of foods which are rich in vitamin A. Supportive care, hydration and symptom management. So if there is a headache, the doctor should go for a treatment of headache. In severe cases, hospitalization may be needed. Then what are the preventive method? Mainly avoid omega doses or overdoses unless medically supervised. Be cautious with the fortified foods. So in India generally it is not a problem. Nowadays what happens is that lot of unnecessary importance have been given by the youth, especially people of your age, going for gym and taking this kind of fortified foods without medical supervision. That can all create problems for us. So there is a natural way by which our body is working. If we interfere in that natural balance, that can create problems for us. Consult a healthcare provider before starting any kind of supplement. And most of the time what happens is that people go to gym and there will be one trainer and will be this is good. Then the person will be buying it. So he or she is not a doctor. So what a doctor, when a doctor is telling they have studied at least for 6 years, then they will be doing the studying again for 3 years MD. So then they may be in that field for several years. So from practical experience, they may be knowing that lot of things which an ordinary person may not be able to tell. So that is a problem. Unless medically supervised, we should not take anything to beyond a certain level. So this is an idea about a different type of vitamin toxicity. Remember that out of the water soluble, compared to the water soluble vitamins, fat soluble vitamins are always more riskier.